Hello, everyone, and welcome back to our next Better Hearing webinar. Today, Maria Roa and I will be talking about hyperacusis and other sound aversion disorders. So, some background on our clinic. I work at the UNC Hearing and Communication Center. I am a doctor of audiology. We are a nonprofit faculty practice of doctors of audiology. We serve as a training clinic and community practice, and that we train doctoral students studying audiology at UNC Chapel Hill. So those are graduate level students. At our clinic, we work with all hearing aid models and manufacturers, and we run on an unbundled or fee-for-service business model. We also offer vestibular or balance testing and tinnitus specialty testing. We have two locations. Our main clinic is off of Farrington Road in Chapel Hill, North Carolina. And we have a satellite clinic out at the Orange County Sportsplex in Hillsborough, North Carolina. So if you call our main number listed there on the screen, you can request either location. Please take a moment to like this video and subscribe to our channel so that you can be notified when more videos are posted. We have new videos coming every month. We do have a live session of this. It's always the first Wednesday of the month at 4 p.m. We'll post a link to our Facebook page, and we post links to the YouTube videos when they're available. So go to facebook.com/UNCHCC to get more information. Today we're talking about hyperacusis. So we'll talk about the signs and symptoms, some causes and known risk factors for developing it. We'll talk about the difference between cochlear recruitment and hyperacusis, how tinnitus fits into it, some other sound aversion disorders, current treatment strategies, and resources for more information. So what exactly is hyperacusis? Most people know it's a sensitivity to sound, but they don't really know exactly what it is. And hyperacusis is actually an abnormal sensitivity to sound that other people would not perceive as being too loud. And so it happens in the brain. And the brain is then perceiving that sounds that are typical to most people, they're too loud. It's pretty rare. About 1 in 50,000 people report having tinnitus. And statistics really vary on the prevalence. So depending what country's research you're looking at, you may see anywhere between 2 to 10% of the general population reporting hyperacusis. And this could be either sudden onset or it could occur gradually over time. Some symptoms of hyperacusis are, of course, a hypersensitivity to sound, pain in the ears, headaches, tinnitus or ringing in the ears, or tinnitus could also be perceived as a whooshing, buzzing, crickets. It can sound like a lot of different things, not just ringing. People with hyperacusis sometimes also report vertigo or a spinning dizziness. In some cases, depression or anxiety comes along with hyperacusis. And it's important to point out that hyperacusis is not discomfort from loud sounds, but it's discomfort from sounds that a typical hearing person would not perceive as out of the ordinary, like running faucet water or kitchen appliance sounds like the hum of a refrigerator or microwave, car engines, and this is not a loud diesel engine, but just a normal car engine, and voices at typical conversational levels. Some people may also report social isolation, so they don't want to go out and do things anymore because of the sensitivity. Ear fullness or pressure, sensitivity that is increased after sudden exposure to loud noises. And of course, you can develop a fear of sudden loud sounds from this. So here are some known causes and risk factors for hyperacusis. Please pause the video to take a look at this list. There are two types of hyperacusis. So there's the cochlear type and a vestibular type. And cochlear is by far the most common type. So cochlea is our sound sensing organ. That's our organ of hearing. And so damage in the sound sensing organ can cause the brain to mistakenly amplify moderate level sounds. And so they seem too loud. In the vestibular type of hyperacusis, however, this affects our balance system. So instead of recognizing the sounds as intolerably loud, the brain may recognize them as a movement sensation, which can disturb your posture, your balance, and a disturbance to your visual focus, which can make you feel dizzy. Tinnitus is a phantom sound that is heard in the absence of stimulation, and it happens in the brain. And hyperacusis is this hypersensitivity to moderate level sounds. Both of these are considered perceptual abnormalities, and they often co-occur. 40% of people with tinnitus will report hyperacusis, and of those with hyperacusis, 86% of those individuals will report also having tinnitus. Both of these perceptual abnormalities can occur or tend to occur after noise exposure or after an acoustic overexposure. So both of these pathologies occur in the brain, and they occur in the central auditory system of the brain. But they typically result from damage to the peripheral ear, so peripheral meaning in the cochlea. So if someone has both tinnitus and hyperacusis, it's typically a sign that there's likely damage in the inner ear, even if that person's hearing is normal. And we term that clinical presentation of having damage in the ear, but having normal hearing, a hidden hearing loss. And just because someone has normal hearing thresholds doesn't mean they always hear, quote unquote, normally in background noise. Hyperacusis can occur and tinnitus can occur even if there's not damage in the inner ear, because it's something that happens in the brain. And the theory behind what could explain that happening in the brain without damage to the ear is neural hyperactivity. So a switch has been turned on somehow in one of the nerves and the neuronal systems in the central auditory pathway, and it's just running and running, and it's hyperactive, and it can be heard as tinnitus, it can be heard as an increased sensitivity to sounds, or both. So there are other sound aversion disorders that we want to go into next. So one of the most common ones is abnormal loudness recruitment. Misophonia and phonophobia are also other disorders that are more rare, but we'll get into those. So what exactly is loudness recruitment? People often will use this synonymously with the term hyperacusis, but actually they're different things. So loudness recruitment refers to the abnormally rapid growth of loudness. So in other words, the volume is turned up maybe a small amount, but a person perceives the change as much greater than it actually is. And so this means things can quickly become too loud or uncomfortably loud. And remember, distinct from hyperacusis happening in the brain, loudness recruitment actually happens in the inner ear itself. And loudness recruitment usually occurs in people with a high frequency hearing loss that are over the age of 40. So I mentioned it happens in the ear, so I want to talk a little bit about this picture on the right. So if we were to unroll the shell-shaped cochlea, we would see that all of the hair cells are arranged in organized rows, and they're arranged tonotopically or by frequency, from high frequency to low frequency. And when there are damage to the hair cells, like in the picture you see there, now sound is not being picked up anymore at those specific frequency ranges. And so what happens, the brain actually sends back down a signal to the other hair cells that are neighboring it to respond where there are dead regions. And so the hair cell that's recruited is recruited to pick up the sound for the adjacent frequency, but it's still tuned to its original frequency as well. So this means it's doing double duty essentially. And what happens then is the sound that reaches the brain seems louder than it is. So this results in a decreased dynamic range between the softest sound a person can hear and the loudest sound that they can comfortably tolerate. So I want to flesh this out some more, and to really understand the examples that Maria is going to go into next, we need to understand the decibel scale. So this is a scale of volume going from 0 being the softest sound a normal hearing person can hear, going up to the threshold of pain at over 100. For reference, average conversational speech is usually around 60 to 65 decibels. Soft speech is around 55 decibels. So I will send it over to Maria now to go through more.
Okay, we're going to be looking at some hearing tests to help flesh these out even more. What we're looking at now is an audiogram, and it's like the decibel scale, but flipped upside down. So now at the top of the graph are very, very soft sounds. As we get to the bottom of the graph, it gets very loud. The X's and the circles represent this person's hearing threshold. X's are the left and the circles are the right. Anything that's below threshold is too soft for this individual to hear. So, for example, 0. Anything past their threshold is loud enough for them to hear and understand. So what happens if we present a very soft sound? Thank you. Well, it's at 0 and it's below this person's threshold, so they can't hear it. Now, let's say we increase sound a little bit more. Now we're presenting sound at 35. It's above their threshold, but if it was speech, it's probably still too soft for their preference. Now at 65, we're reaching normal conversation levels, and this sounds just right for this individual. However, as we start nearing the bottom of the graph, now we're almost reaching 90, and this is starting to get loud. Once we finally pass 100, we've reached this person's tolerance level. So that's normal hearing. What about hyperacusis? Hearing sensitivity might still be normal. However, at 65, this person is already capped in their loudness tolerance. And so again, sounds that would typically be comfortable are unbearably loud in hyperacusis. Loudness recruitment, as Dr. Whitson already mentioned, is associated with hearing loss. And as you could see, this audiogram is a little different. Now we're looking at X's and circles that are getting towards the bottom of the graph as we get higher and higher in pitch. What that means is that we needed a lot more volume in these higher pitch range to get a response from the person. So what happens if we present an average sound, let's say around 55 decibels? Well, they're getting some audibility in the lower pitches, but they're still missing that higher pitched range because of their hearing loss. So they need you to speak up. At 70, we finally caught majority of those higher regions, so it sounds just right. But what if we increase volume just a little bit more? All of a sudden, very quickly, we've reached this person's cap for tolerance of loudness. In loudness recruitment, this happens very, very quickly because they have a reduced range for hearing. Two other sound aversions are misophonia and phonophobia. Misophonia is a condition that individuals experience negative reactions to a particular sound, regardless of its volume. So for example, chewing is a very soft sound on the decibel scale. However, a person with misophonia might find chewing completely intolerable. And however, they might still be able to tolerate sounds even louder than chewing. So the reaction is very specific. Phonophobia can often result from hyperacusis or misophonia, and it's the persistent fear of sound. Individuals with phonophobia also may experience severe anxiety at the mere anticipation of the sounds that they fear. This could be road noises, loud speech, things that they anticipate going off, like alarms or other sudden sounds. Luckily, there are treatment options for all of these different sound aversions. Most common, we see auditory retraining therapy coupled with professional counseling. Auditory or sound therapy is done by an audiologist, and the audiologist uses low-level amplification to work with these individuals and help them habituate to the sounds that they find discomfort from or intolerable. When working with a psychologist or a cognitive behavioral therapist, they use mindfulness techniques or other parts of CBT to help the individual reduce their negative reaction to bothersome sounds and think about it in a more positive light. And of course, in very rare circumstances, individuals may be eligible for surgery. In certain types of disorders, there is a weakness in the bone of the middle of the inner ear structure. So when there's a weakness in the bone, sound is able to pass through more easily. In these circumstances, an ENT surgeon may be able to surgically reinforce the bone and therefore stop sound from passing through as easily. Like I said, an ENT physician is the one that needs to make this call and diagnose the disorder. Most people with sensitivity to sound are prone to protecting themselves from those sounds, but I would caution you strongly against this. Overuse of hearing protection is universally discouraged because it lowers loudness thresholds over time, and it could actually prevent people from building sound tolerance. On the other end, don't go out there and expose yourself to noise that's also damaging to your auditory system. That's why it's really important to work with an audiologist who will gradually build your tolerance to sound in a measurable and very safe way. Most people watching this have hearing loss or likely wear hearing aids. And at this point, you might be asking yourself, well, can people with sound hypersensitivity even wear hearing aids? The short answer is yes. However, the audiologist has to do certain things to ensure that they can wear hearing aids comfortably. A very important measure that needs to be taken is called loudness discomfort levels, or LDLs. And you could see these at the bottom of the audiogram. There they are. And that's the person's cap or their limit for tolerance of sound. We use LDLs to ensure that the maximum power output or the maximum level of sound that's coming out of a hearing aid never exceeds the individual's comfort level. Now, if you've attended any of our previous webinars or have checked out our videos on YouTube, then you know that real ear measurements are extremely important. So I won't belabor the point today. However, I will say that REM is extremely important to confirm that the maximum power output of the hearing aid in the patient's ear is below their loudness discomfort levels. For those of you out there that just got their first pair of hearing aids or possibly just got an updated prescription with reprogramming, you may be feeling like the sound is overwhelming. You might find that even doing the dishes or listening to the air conditioner is extremely overwhelming and annoying. So does that mean that you have hyperacusis? Probably not. This is actually a completely normal response for brand new hearing aid users. When you've gone a long time not hearing certain sounds, once they're finally reintroduced, your brain pays a lot of attention to them, which can make them seem louder for a period of time. But with daily and consistent use, the brain learns and it's better able to differentiate those unimportant noises in our environment from sounds that actually deserve our attention. So if our last slide resonated with you, this next one is for you. Here are some tips to unlock expert level. You should start by using your hearing aids in quiet. Try wearing them while you're at home, and yes, even while you're home alone. Try using them for one-on-one conversations. Go outside, go for a walk, and listen to all of the sounds in our world, to the road noise, the birds, the wind, etc. Try listening to commentators from either the radio or TV because they're likely better communicators. And I would probably hold off on watching that musical or British sitcom. If you're currently wearing your devices for 3 hours a day, next week, challenge yourself to wear them for 5. The following week, try 6, 7, and 8, and so on. Increase your exposure to everyday sounds gradually. And remember, noisy restaurants are difficult for everybody, so it's okay to ease into it if you need to. Hyperacusisfocus.org is a great website to go check out if you have more questions. They have a lot of forums and updated research and Facebook groups for individuals going through this. And of course, come and talk to your audiologist if you have concerns that any of this applies to you. So some takeaways. In sum, hyperacusis is when normal sounds are just too loud for tolerance. And remember that tinnitus and hyperacusis can often co-occur. Cochlear recruitment is associated with hearing loss, and it's when small changes in noise levels seem much louder. Misophonia is annoyance to a particular sound, regardless of its volume level. And phonophobia is that development of fear of sound. The best treatment options involve a mix of sound retraining therapy and professional counseling. Please be sure to join us next time. If you can join us live, we will be presenting October 6th at 4 p.m. on ototoxic medications. And we have a guest speaker, Anne Morgan Selleck. And lastly, here's Dr. Whitson's contact information and more ways to contact our clinic.
Thank you everyone for joining us for today's webinar. Please be sure to check out our channel to check out more videos. See you next time.